wreaking havoc on your life, looking for a way to get a bit of relief? Here to help, please welcome back Dr. Michael Kaplan from the Houston Sinus Center, along with Vidal Knight, who suffered for years with allergies but doesn't anymore. We'll tell you what she did about it in a minute. But when it comes to allergies, I mean, gosh, when you look at what you can buy over the counter these days, it's amazing. And a lot of people can get things taken care of.
Absolutely. Medications that used to be prescription only are now available over the counter, often at the same dose, same frequency, with the same efficacy.
Yeah, of course, the tough part with that is that we start to self-medicate and we think, well, that first dose didn't work, I'll just take another one because I'll double up and surely that'll take care of it. So people not using them correctly is a danger.
Follow the directions. If you don't get better, call your doctor.
Yeah, and of course, if you're using this as a maintenance drug every day of your life, you might want to look at getting rid of the problem as opposed to medicating the problem, right?
If you're using the medications every day, you're not getting better. It's either you got the wrong diagnosis or you got the wrong medication.
All right, Vidal, what was your situation with allergies?
I actually get started with a sinus infection, which was probably not the original start of it, but that's when I really got sick and I had been going to Dr. Kaplan for a while, but I think he kind of, when I told him I had a sinus infection, that's pretty common in Houston,
right?
And he was like, really? So, but he sent me to get an MRI, and when I came back, he was like, yikes, you really have a sinus infection. So I had surgery that he did, and then I started taking allergy shots. And to be quite frank, I haven't even had a cold in 7 years.
Wow, okay, so the issue's gone. Okay, let's back up a little bit. And yeah, people can start off by having some sinus issues, but when it swings over into the infection is where you really need to get in.
Oh, absolutely. And allergies, you know, the itchy eyes, itchy nose, watery eyes, postnasal drip, if it gets worse, it causes swelling of the sinuses, blockage of the sinuses, headaches, pressure. That develops into an infection. If that doesn't respond to medication, it leads to surgery. But if the allergies are the predisposing factor, controlling those allergies prevents that problem from recurring, and that's where Ms. Knight has had incredibly good results.
Yeah, because, you know, up there, you look at it, it's kind of an incubator, if you will.
Exactly.
Things get all blocked and stuff. And so, yeah, ears, everything gets plugged up. Okay, so what in particular was the surgery you did on her, and is that something that lasts a lifetime? Because she said 7 years now.
Right. She had endoscopic sinus surgery done about 6-7 years ago.
Okay, I'm going to stop with that word, endoscopic, which we hear a lot, which is a good thing.
Sure. She was brought to the operating room using a little rotor-rooter device that opened her sinuses. But given the technology we have today, if Ms. Knight had recurring problems or if she came in de novo today, we would be able to help her in the office using a tiny balloon.
Oh, wow.
Without having to go to the operating room, achieving the same results.
Yeah. Okay.
That's the beauty of it.
Yeah. You can come right on in, get it done. So what that little balloon is doing is opening the passageway.
It opens up the sinuses. You come in, have it done. The whole process takes less than an hour, and you walk out on your own 2 feet. No packing in your nose, no excessive bleeding. You're back to work oftentimes the next day. It's an entirely different process.
Yeah, and breathing better. Yeah. Okay, so back to the allergy part. There are a couple of questions people had. One was, one of our producers grew up in Houston, never had allergies, and now over the last several months, she's got allergies.
Sure.
What happens in our body when it just decides it wants to act up?
It's like it's a change in the immune system. Something changed, a little kink. A person can take penicillin their whole lives, and at 50 or 60 years of age, develop a sudden onset of an allergy to penicillin. If I were to sit here right now and give you an exact answer, I'd be lying. Nobody really knows. But the immune system can change over years. And that's the answer.
Okay.
That's the answer.
Yeah. And once you get rid of one allergy, you could have another one.
Absolutely, yeah.
Okay. Let's go back to the medication because, again, we have things that are available for people to use. What's the biggest mistake that you see people make with the medication? And at what point do you pull that trigger and say, I got to go see a doctor?
2 things. Afrin is not an allergy medication. People can become addicted to it after using it for 2 or 3 days. Second, adding a decongestant to your antihistamine can increase your blood pressure, increase your heart rate, and give you incredibly difficult to tolerate insomnia.
Yeah, and one of the other things we do is when it has a multi-symptom, right? It's like it'll give you a car oil change and take care of your allergies.
Sure.
It pays your bills, it does everything. We get the multi one because we think we'll throw everything at it. There's a disadvantage to sometimes throwing everything at it.
And you could be dealing with an infection. And the allergy medication you're taking can actually dry you up too much, increase your headaches, and make you worse.
All right, you said you have some patients who call you and say, I'm too sick, I don't feel good.
Yeah,
to come see you? What suggestions do you have for them? Because you were at that point at times when you were just out of it, and you just couldn't deal with it anymore.
Oh, I think I probably waited too long. But, you know, it's crazy. you get in to see him pretty quickly, and you can get out of there and get well.
Yeah.
I think going to a good doctor that knows your symptoms and knows what they're doing is probably the key to good health.
Yeah, and getting your life back.
And having a good patient.
Okay, so
do
we
what
know
he
that.
says.
Sometimes with allergies, people deal with medication. Sometimes they deal with those allergy shots. So what are some of the common methods to help somebody either, and I guess what we're doing is training the body not to freak out over something anymore,
Sure,
right?
sure. Once the over-the-counter medications aren't working, we can do either allergy skin testing, blood testing, and with that we can identify what the person is allergic to, what mold spores, pollens, tree grasses, pets, dust mites
Some
in the
things
house.
you can stay away from, and
Absolutely.
that helps. Other things you need.
Avoidance or treating with allergy shots. And the allergy shots build up antibodies in the blood that prevent that person from mounting an allergic reaction.
All right, so you can be well. Well, to make your appointment with Dr. Kaplan at the Houston Sinus Center, call 713-926-5055, 713-926-5055. And for more information, log on to the HoustonSinusCenter.com. You're in the right city for that, HoustonSinusCenter.com. Well, imagine skipping meals with friends and family at restaurants or parties because you know you'll have to rush to the bathroom minutes later. Sometimes when our health issues seem embarrassing, we put off getting help. Up next, the problems that plague our digestive tract and how to manage them to improve your quality of life.